Rehabilitation and recovery after a total knee replacement. This is the third presentation for patients contemplating total knee replacement surgery. This presentation is not meant to replace formal information leaflets or the appropriate face-to-face consent process, which is tailored on your individual risk factors. The anaesthetic. Total knee replacement surgery is commonly performed using either a general anaesthetic, i.e. with you unconscious, or a spinal anaesthetic, plus or minus intravenous sedation. Both methods are safe and effective, and both have advantages and disadvantages. The final decision is usually made on the day of the operation after meeting the anaesthetist. Mobilization. When does it begin? Mobilization usually begins the next day after the operation, but on some occasions late on the day of the operation. The mobilization begins under the guidance of the physiotherapist, often using a frame at first, then going on to crutches and sticks. It will seem tricky at first, but is not usually too painful. Painkillers and antiemetics. Local anaesthetic and other drugs are often injected around the knee to decrease the pain post-operation. The anaesthetist gives intravenous painkillers during the operation and supplements these with injections, tablets and syrups to control the pain after the operation. Anti-sickness medication, known as antiemetics, is also given to control post-operative sickness. During the 2 to 3 day stay in the hospital, nurses will give you painkillers and antiemetics to help control the pain and sickness. We avoid giving you too much analgesics, as this can lead to problems with vomiting, dehydration, excessive sleeping, and poor compliance with exercises, which can lead to complications. Constipation is a common side effect of the drugs, and laxatives are often needed. How long do I take the painkillers? Normally a minimum of 4 weeks, but more commonly 8 to 12 weeks after the operation. The strength and frequency should gradually drop down. Variations from day to day occur, and it is not unusual to have to increase the frequency or strength for a few days. Non-steroidal anti-inflammatory drugs can be recommenced approximately 24 hours after completing the enoxaparin injections or the rivaroxaban tablets. However, they should only be recommenced if you're well, the wound is fully healed, and there's no renal or gastric problems. Will I manage the stairs? Should I move my bedroom downstairs? These are two frequently asked questions. The physiotherapist will practice stairs with you before you go home. Mobilization is the key to gaining strength, balance and confidence. We therefore encourage patients to try to carry on as normal at home, and the vast majority of patients don't need to move their bed downstairs. Will the knee be swollen? The vast majority of knee replacements are swollen in the first few weeks or months after the operation. The swelling makes the bending and straightening exercises difficult. However, if we wait for the 6 to 8 weeks for the swelling to settle, the knee replacement will have scarred up and movements become limited. We therefore have to encourage both straightening and bending exercises. How long before I can drive? This is a frequently asked question. The answer depends on your progress and your analgesic needs. It is unsafe to drive if you need strong codeine or morphine-based analgesics. It is unsafe to drive if you cannot comfortably bend and straighten the knee to do an emergency stop. Most patients can return to driving at around 6 to 8 weeks post-operation. Patients having left knee surgery with an automatic car may get back a little earlier, usually 4 to 6 weeks, but need to consider their mobility and analgesic requirements. Why do I feel so tired? This is a frequently asked question. It must be remembered that this is a major operation associated with blood loss and the need for painkillers, etc. It is usual to feel tired, for your appetite to wane, your sleep pattern to be upset, and generally feel out of sorts. We sometimes call these feelings the post-replacement blues. They usually come on several days after the operation and last several days to months. When can I start going out? Returning to a normal lifestyle is an important factor in recovery after surgery. Depending on weather conditions, etc., it is important that you try to return to normal activities such as brief shopping trips as soon as possible. When can I start kneeling? Modern knee replacements are designed to allow kneeling. As most knee patients with arthritis have avoided kneeling for many years, it is important to retrain yourself to kneel again. This should start once the wound is healed, usually around 2 weeks post-operation, starting with kneeling onto a cushion. The 3 slights. It is usual for a knee replacement: 1. To stay slightly swollen for several months, sometimes long term. 2. To stay slightly warm for several months, sometimes long term. And 3. To click slightly on some activities. However, if any of these features increase, medical advice is indicated. How long is the recovery? The advice I give is the first 6 weeks are tough with pain, swelling, and difficulty with movements. Between 6 and 12 weeks, there is definite improvement, but it's still quite a tough time. After 12 weeks, there is a gradual, gentle, slow improvement up to around 18 months post-operation. The 12-month review. We routinely review patients approximately 12 months after their operation. The vast majority of recovery has occurred at this time. A check X-ray is performed at this point, and if all is satisfactory, discharge from regular orthopaedic follow-up occurs.